What evidence is there, or is there any evidence that attention to these psychosocial concerns results in a better outcome from treatment?
Well, there are a number of studies that are valid and well done that shows a reduction of anxiety, of depression, better quality of life, handling their illness better, adhering to treatment better, being able to tolerate side effects of treatment better. So there is an ample evidence base for saying that these kinds of treatments are a part of a clinical practice guideline. And if you're not following this sort of minimal guidelines, then we would like to get this to a point that we could give an institution a report card that says you are not meeting the standard, and therefore your report card says you got an F. And that can come once you have established an evidence-based base. And I think we're close to getting that. So it would be for the first time there would be some accountability for how you treat patients from a psychological perspective. There is no accountability, none. You can have zero interest in this and nobody's going to say anything.
But you're saying interventions do work.
Oh,
at least
they work.
The quality of life of the patient is better, if not lifespan being longer. But why, I still don't understand if the evidence is there that this is good for the patient, why treatment centers aren't providing this breadth of service.
Well, the evidence is there, so we have proved that a long time ago. And I kept thinking, well, if we do the research, then of course they're going to use it. Well, wrong. I think it's attitudinal. It'll cost a lot of money, you know. Why do we need another social worker when we really need a new radiotherapy machine? And you can guess which is going to win out. A new machine, a new drug that costs $2,000 a pill. That's where the money goes. And the kind of simple things like incorporating some way to identify who's distressed just is so simple to people, I think, and is not seen as a routine part of care. So our goal is that we must have psychosocial integrated into the routine visit of a patient to an oncologist. And this applies equally to any chronic disease. While we have studied cancer, the principles, the hypotheses we've put forth work absolutely well with cardiovascular disease, diabetes, chronic neurological disorders. So we think if we can implement the recommendations of this very well done report, it can have an impact on all chronic diseases. Chronic disease is the problem of our 21st century.
So you would say that the situation or the lack of this kind of service is just as prevalent in cardiovascular disease, diabetes, perhaps arthritis, other kinds of chronic ailments.
Absolutely.
Is there any evidence at all that paying attention to these in the long run could save money?
Yes. There are some offset studies that are being done to show that you actually save some money by doing this. And these kind of studies are coming out of some of the behavioral health organizations that fund healthcare, and they're beginning to see, well, if we even provide a telephone call to follow people, a case manager approach, it may actually save them insurance dollars. So I think we need more of those kinds of studies. We need real-world studies, putting a demonstration together in a clinic somewhere, not doing it in another clinic and comparing outcomes. That kind of real world, not research settings, which are rather different from the real world.
Now, I suppose you're concerned about this Institute of Medicine report simply sitting on a shelf someplace, like too many other reports that are issued both by IOM, the Public Health Service, or the NIH, or what have you. What steps are you taking to see that at least a portion of this, if not all of it, is indeed implemented and finds its way into everyday practice?
Well, you're absolutely right. The report's worth nothing if we don't implement these recommendations. And the Academy of Psychosomatic Medicine is one of the main organizations that we hope will pick this up, look at the recommendations. What can this organization do? What can the social work organization do? We must use all of the associations that do supportive kinds of psychosocial intervention. But we also want to involve patient advocate organizations. There are many of those in this country. The leukemia, lymphoma, colon cancer. These organizations are very enthusiastic about better psychological care.
How about the American Cancer Society
Oh yeah,
itself?
well, we're counting on them strongly, sure.
Okay.
Be a major player.
Now, there are a number of recommendations in
Yes,
that
10.
report, 10 of them.
Call them the 10
Which,
Commandments.
if you had to, if you had an opportunity to implement only one of them, what would it be?
It would be, number one, the standard of care. It's a simple little diagram that says there has to be a partnership between the doctor and the patient. And that then there must be an assessment of the patient's psychosocial situation. It could be one question, it could be a little questionnaire, it could be a touch screen being used in some places. And when you find what the person's level of distress is and where it's coming from, then you can link them to the kind of services that they need. But in addition, you support the person during their illness, help them to cope with it, and tie it into their medical care. And then they should be assessed again in intervals.
So assessment should be part of the standard.
Assessment and putting in place a treatment plan for whatever their psychosocial needs are.
Okay.
It's so simple. It's so simple. I'm afraid nobody believes it because it's not, big bells and whistles.
Yeah, true. I can imagine. If I go to the doctor and the doctor says, well, I think you have cancer of whatever it might be, and we're going to work up a treatment plan, how can I tell whether or not my psychosocial needs have been assessed or even should be assessed?
Right.
Because I may not be recognizing that the problems of daily living that I'm having are something that impact on my illness.
This is a very real issue, and I think this is why a routine screening really needs to be done. And then we can identify that and to point out that you do need some help. And help is available even if it's no more than by telephone to help somebody get through illness.
Okay, Dr. Holland, thank you very much. But I have one other question. If people want to get this report, how can they do that?
They certainly can. They can download the summary from a website of the Institute of Medicine. They can also go to the website and print out the whole report or order it in its
Okay,
full
and
report.
is there anything that you'd like to add to this that perhaps we haven't covered that relates to the report or the problem of inattention to psychosocial needs?
I think we've covered most of the points. It's going to be a major effort within this next year to be sure that we have made patients and families aware of this, educate them, and educate professionals. One of the things we're doing is putting together a little card that patients could find in their doctor's office that says, if you have emotional problems or anything, this is a part of your routine services. Ask about it if you didn't find it as part of your care. This, I think, begins to empower families and patients. It begins to say, this is a part of your care and it's your right. Okay. So that's
Dr. Holland, thanks very much for being with us
Thank
tonight.
you. Terrific.
We enjoyed it.
good. Me too.
Thank you.